outside of the Chinese Communist Party itself or the World Economic Forum and its little COVID dictators like Trudeau and Ardern, I don't think there's an international organisation in the world I trust less than the World Health Organization to manage future international pandemic policy. Let's just be straight for a moment. As I've been saying since April 2020, the WHO, with Dr. Tedros at the helm as Director General, aided and abetted the Chinese government in covering up the origins of the COVID-19 outbreak in Wuhan with truly devastating consequences for the world. It praised China for transparency at a time the state was killing whistleblowers and claiming human-to-human transmission of the virus was impossible. There's been no consequence for China, the rogue state for whom the WHO seems to do its bidding. Still no honest investigation, still no answers, still no reckoning. Donald Trump was the only world leader prepared to stand up to this dangerous international organisation, withdrawing funding for the WHO. But now we're all meant to nod along blindly, as if the WHO has our best interests at heart. Like hell they do. That's why I am deeply angry and even more concerned about a so-called World Health Organization pandemic accord to be discussed when the body meets this Sunday for the World Health Assembly. The accord is expected to increase the power of the WHO in the pandemic response by individual states. And we know what that means. More lockdowns, more masks, more jabs, and less freedom. And where are our politicians? Only one. I can find only one. The heroic Steve Baker has actually raised any questions about the WHO's pandemic accord. He wrote, I just tabled a written question to Sajid Javid asking for both a written and an oral statement on the UK's negotiating position in relation to the proposed international agreement on pandemic prevention, preparedness and response under the auspices of the WHO. He added, as I have said time and again, lockdown powers need reform. There can be no question of signing up to a treaty which hands those powers to an unaccountable international body, and I would be amazed if Boris Johnson and Sajid Javid intended to do so. Well, we need to find out. So where's all the TV and newspaper coverage of this? Well, the mainstream media too is in lockstep with the WHO and Bill Gates over the correct approach to pandemic management, even though both the organisation and the man got it all spectacularly wrong. Gates is out at the moment promoting his book, How to Prevent the Next Pandemic. According to one uncharitable reviewer, quoted by Matt Ridley, writing in the Daily Telegraph, the book's main message is, quote, that we can prevent the next pandemic by doing all of the things that did not stop the last pandemic event, only more faster and harder. But just look at the way CNN's Anderson Cooper engages with Gates over his nonsensical plan to vaccinate the world every 6 months, regardless of natural infection.
Had 2 vaccinations and then 2 booster shots. Is that right?
That's right. And, for people over, 50 or 60, they'll probably have to be boosted every 6 months until we get even better vaccines.
So I've been trying to figure this out for myself. I assume you know the answer to this, so I'll just ask you. When do you get boosted again? I mean, now that you've had it, I've had it around the same time. I've only gotten 3 shots total, only been boosted once. I guess we have immunity for a little while, but when do you decide to get boosted again?
So an infection where you'll get a high viral load would be like vaccination. But, to be safe, every 6 months, you're probably going to be vaccinated. As we get more data, they might even make that shorter for people who are, say 60 or over 70, where the duration seems to be a bit lower. So we're in for ongoing vaccination to stay absolutely safe.
Why do we keep listening to this dude as if he's the oracle? Bill Gates has proven himself to be not very smart during this pandemic at all. Watch.
It wasn't until early February when I was in a meeting that experts at the foundation said, there's no way, there's been too much travel without diagnosis for us to contain this. And then at that point, we didn't really understand the fatality rate. We didn't understand that it's a fairly low fatality rate and that it's a disease mainly of the elderly, kind of like flu is, although a bit different than that. So that was a pretty scary period,
right,
where the world didn't go on alert, including the United States, nearly as fast as it needed to.
What is he talking about? Anyone looking at the data and avoiding the hysteria knew exactly who was most vulnerable to COVID. If Bill Gates and the World Health Organization are allowed to take control of international pandemic policy, mark my words, we're in deep trouble. Neither accept the failure of lockdowns and jabs in preventing infections. Neither talk about the devastating economic firestorm and wave of deaths coming thanks to 2 years of lockdowns. And neither stand up to China for either the lab leak lies or the zero COVID disaster.